So I have this double chin, right? The pseudo double chin, which I'm not sure is perhaps a consequence of a low high bone position, or perhaps a deleterious downstream effect of poor neck posture from childhood. I'm not really sure. I couldn't tell you, but I'd love to figure out why, perhaps. So I've got that highlighted there to come back to later. Um, Fourthly, sort of plays into the double chin here. A lot of face fat, a lot of face fat. I don't have anybody in my family with a chubby face. I mean, my mom's got a bit of a baby face, and she's got very pronounced cheeks and cheekbones. The face fat thing has been extremely confusing to me since I was a kid. I was sort of waiting to turn, 22, 23 like I am now, and hopefully get a bit of a leaner face. And that has happened a bit, but at the same time, I'm confused why I hold so much fat in my face, other than, of course, the obvious genetic predisposition or something to that effect.
Mm-hmm.
And again, no family members with extremely chubby faces or anything like that, and we're all very lean and so on and so forth. I have heard, if it's worth mentioning, that some people, when they improve their neck posture and perhaps adjust their sleep position, experience a leaning out of the face and cheeks, or the classic Mew swallowing techniques or something that don't utilize the buccinator muscles in the cheeks or something like that. Not really sure. We can touch a little bit on that in a bit if you want. Fifth, I have relatively poor sleep quality at the moment. Lethargy, chronic fatigue, brain fog, all the classic symptoms of not getting proper REM sleep. And so that's why I got the septoplasty and the serpinoplasty, because when I went to an ENT, he noticed that I did have some clear structural obstruction on the left side of my nose. So he went in there and took care of that. And that seems to have improved my issue by 40% or so, give or take.
Well, that's pretty good.
Yeah, it's not bad. I've enjoyed the benefits so far, but I have noticed some regression since I got the procedure. Obviously, the first few weeks of that recovery are pretty rough, and you can't breathe through your nose whatsoever, right? But then it got really, really good. I was experiencing almost not quite an empty nose syndrome. It almost felt like it for a bit, and it regressed a bit. Now I'm starting to notice some disparity between the two nostrils, but I'm sure that's slightly normal. I don't think you can get a perfect end game with this procedure. So, and then a couple things to finish off here with the symptoms. My tongue feels really crammed between my molars when I try to mew. And granted, you'll see in a moment that I don't know if I'm mewing properly or not, but I like to think that I am, especially given that I've watched your content and Dr. Mew's content on the suction hold and things like that. I've tried my best to perfect that as much as possible. But even so, my tongue still feels very, very, very crammed between my molars, even with this 44 millimeters of intermolar space, which, correct me if I'm wrong, is pretty decent amount of space.
Definitely above average. Yeah, way above average. I mean, I was talking to someone earlier who was at like 24.
Yeah, I watched a podcast with an Asian kid my age as well. He had about 23, 24 millimeters of space, and that was. You were talking about if he could even get an MSC fit up into there
Correct.
in the first place.
Correct.
Which was really interesting. And then just to summarize the symptoms here, just an overall degradation in my facial appearance in the recent years. Granted, you have to take that with a grain of salt because I am so hyper focused on my appearance and so on and so forth. However, again, like comparing and contrasting different images and noticing certain things over others, I feel as though perhaps there are some symptoms that may be contributing to inflammation or different things that perhaps exacerbate asymmetries, something to that regard. So just some speculative points here. My initial dystrophy in childhood and early adolescence seems to have been obviously attributable to my poor posture and mouth breathing, of course. And so I took those corrective measures I mentioned earlier, in addition to things like chin tucks and mouth tape. But the dystrophy was always present. I always had a lack of facial development, which has improved tenfold since then. But there are still things that to be improved upon, of course, which is why I'm here. And of course, like I mentioned earlier, the asymmetry itself was not really noticeable prior to puberty. I noticed it around 15, 17, something to that effect. Like I said a minute ago, I was mewing for about a year now. with a high level of commitment, but a poor level of consistency in the posture of my tongue and technique overall. So we can talk a little bit about that later, but that's one of the points I wanted to touch on. And one thing I've been ruminating on is that perhaps the incorrect hard mewing that I was doing earlier, along with possible stress in my personal life, has birthed some sort of craniofacial torsion or tension, causing asymmetry or exacerbating it. And the TMJ also seems to be attributable to improper mewing and personal stress, of course, because you clench your muscles with stress and you hold stress in your face and head and so on and so forth.
Mm-hmm.